When we talk about outpatient surgery, it's not for everyone. So the questions often asked is, who's a candidate for outpatient surgery? Number one, the patient has to fit all the requirements needing a hip or knee replacement. Secondly, the patient has to hit some health milestones, meaning that they don't have any major medical issues that would require them to be observed in the hospital overnight. And thirdly, and almost most importantly, is that they have to have help at home. They have to have a spouse or a significant other or other caregivers that can help and be there, especially for the first 5 to 7 days to help them recover.
I start to try to put their mind at ease. I want to outline, listen, you're going to have a total knee, or maybe you need to have a total knee. I try never not to use the haves or must, things like that, because it really shouldn't be my decision. It should be you as the patient's decision. We have together hopefully tried and unfortunately apparently exhausted our conservative efforts, whether it's injection or physical therapy, bracing, topical, oral anti-inflammatories, but a number of issues that we've tried, and if we've been unsuccessful, you as a patient are still looking for the relief that you're wanting. I as the provider am wanting to give that to you. Probably the most consistent thing that I hear is, I felt like I was the center of attention. And really that's what the Outpatient Surgery Center is, you are the center of this very small group, close-knit group of people's attention. You have the same point of contact person leading up to the surgery who is doing your preoperative total knee boot camp, who has gone through the ins and outs, the anticipated hurdles or questions that you may arrive at that you didn't even know to ask up into the process. And it's the same person that you pick up the phone and say, hey, my bandage is starting to peel up. Is this anything to actually be concerned about? And so I get people coming back to me saying, one, I love my knee. And that's the outcome that we should have regardless of where they have the surgery done.
Patients really didn't know about us because it wasn't really an accepted practice in this area. But now patients are actually asking, can we go home the same day? And I've even had an 81-year-old lady recently have an outpatient surgery. And again, if I don't look at age, we look at a patient's overall health status and overall home situation. And if they meet all those requirements, they can go home. Patients should ask about it and trust that it's not for everyone, but it is an option for more patients than you would think. And right now, after we've been doing this for now probably a better part of 3 years, the results have been overwhelmingly positive. Our main goal with the Orthopaedic Institute is give everyone in our total joint program a perfect long-term result.